Hey friends, Dr. Christy here, and it is that time of year. Patients ask me frequently, what can they do to not only help prevent colds and flus and strep throat and bacteria and things of that nature all the time, but also when you get sick, what can we take to not only shorten the duration of said illness, but also just make yourself feel better and eliminate the illness so that you're really not depending on antibiotics or medications. What can people do instead of the traditional Western approaches, okay? So I'm gonna make a couple different videos about this because I'm just gonna bomb drop a bunch of things that I find in my practice that I have as a go-to all the time for different types of illnesses and potential issues that you might come across. So today I'm really gonna focus mostly on if you think whatever you might have is bacterial. So this is not prevention. This is if you have something diagnosed with a bacterial infection and the approach is about to be an antibiotic. Now, first and foremost, a disclaimer I really want to put out there, strep throat, different types of bacterias, typically they can, especially from a Western approach, they can require an antibiotic. I'm not anti-antibiotic. Sometimes these things are necessary. And of course, I tend to want to avoid these things as much as possible. It will mess up your gut. It will in fact destroy your gut. Sometimes it's worth destroying your gut as opposed to having a really significantly detrimental impact to your body from a bacterial infection. My son himself had strep throat about a year and a half ago. He had to have the antibiotic. And once I realized what it was, I was so tempted to just say, you know what, I can treat this naturally, we can do it. But by the time that we had figured out what it really was, it was not worth really trying to go that approach. Sometimes you just need to trust your gut and do the Western approach. So I'm not telling you to do or not to do any of those things. These are some different herbs to consider if you're looking for a more holistic approach to a bacterial infection. And always trust your gut, always go to your local trusted doctor and physician to get what's best for you and your body, because only you guys can know that. All right, so herbs and other things that I often recommend when someone has a bacterial infection. From the first standpoint, basic vitamin support, anything immune boosting. And once again, I'm gonna literally throw a giant fire hose of these things at you. I oftentimes do not tell people, my patients, to take every single one of these things. But at the same time, I do find that the higher dosing and the more that we give ourselves when our body is stressed and depleted and under illness, it can really flood those systems so that it saturates every single thing in the body that it's been depleted in. And that combined with different rest and fluids and things of that nature, of course, your body will recover faster. So vitamins I often recommend, obviously vitamin C, vitamin A, zinc, selenium, vitamin D in high doses. I have no problem dosing high vitamin D for a short period of time. I'm talking like 2 or 3 days. You can dose it by 50,000 units per day. 50,000 units per day for a couple days. You will not overdose on vitamin D if it's this short term. Outside of the vitamins that I just mentioned, I also really love certain herbs like andrographis, oregano oil, garlic, colloidal silver, Japanese knotweed. I can't remember if I said golden seal already. Olive leaf, Malia, Ursi. Some of these are so powerful that they actually are comparable to Westernized antibiotics. They are a natural, holistic, and herbal antimicrobial. So they will do the same thing, but with a little bit of a gentler approach on the gut. It doesn't take out everything in its path. It's more targeted towards the pathogens that impact us in a negative way. So if you have a bacterial infection, there are absolutely ways to get rid of it. I have literally told people to chew on a clove of garlic or take a drop of oregano oil and, you know, swish it around in the back of your throat. So much of this has been able to be eradicated with the use of some of these products. And especially if you are consistent and you act quickly. The situation with my son last year, we just didn't act quickly enough because I didn't know what it was. And now that we know better, we always can do better. So just a couple of nuggets for you for your day. If you're struggling with something, please feel free to reach out to your local practitioner or myself if you want a more specific and personalized approach, because once again, there's just a whole lot of stuff that I often recommend in general, and not everything is necessary for everyone. So that's all I have for you today. If you have any questions, drop them below, and I hope you have a good day.